What is a pediatric patient? Well, for us at the Sexual Assault Treatment Center, a pediatric patient is a child who is prepubescent, so for females who hasn't started their periods yet. Boys, we usually look at them at about 12 years of age or younger. So when you bring your child to the Sexual Assault Treatment Center for an examination, we know when those kids walk through the door that they're anxious, don't know exactly what to expect. And so we want to take that anxiety level and throw it out the door because we want them to feel comfortable with us. Generally speaking, we're going to greet them at the door. We're going to hopefully develop some rapport with them. That may mean sitting and playing with them, giving them a snack, introducing ourselves to them, letting them get familiar with where they're at. We also talk to them about why they're here. We talk about the examination process of how we're going to examine them from the top of their head to the tips of their toes, and that we're kids nurses and we do this all the time. So we want them to feel very comfortable with the examination process. We have a few surprises for them usually, and one is they get a really pretty robe to put on and to take home with them. We have a blanket for them to hold on to as well as a stuffed animal. Just letting them touch and feel things that are in the room, to ask questions, just to be in control. They kind of get to guide, they're in control of this show. I think that really helps our children then be able to cooperate with us when we really do need to do a good, thorough, comprehensive examination on them. When we go to the exam room, if the child wants mom or a guardian or someone to be with them, we encourage that. We like to have a parent there.
The sexual assault nurse examiners who practice in the field of pediatrics have received specialized training and education in the care of children. We learn to examine these children under the skills of what's developmentally and age appropriate for these children, what their cognitive ability is. Also, we have specialized equipment.
Our examination is a non-invasive exam, so we don't poke or prod. We don't cause any pain. We say it's a no tears exam.
But also it's letting the parents know that things are okay. I think it's important that they want to make sure that their child is healthy. And so one of the things that we can do is make sure that there's no residual, injuries or scars. There's no evidence of any sexually transmitted disease.
Why don't children report in a timely fashion? Typically, who harms them is someone they know, love, and trust. And because of that, they are told not to tell, and they don't tell. They have loyalty, they love that person, and they simply don't tell. When our children walk away, and parents walk away, we want children to know that their bodies are perfect, that they're put together just like God put them together, that they are not damaged goods, and that they're whole and complete, and that is so important.
It's nice to have the parent in the room when we do this because they're also getting affirmation as well as the child that everything is okay. And so we can again start the process of moving forward and healing from there.